Millions of people have witnessed their life being affected by the coronavirus disease, known as COVID-19. The clinical symptoms of COVID-19 patients include fever, cough, fatigue, with other symptoms such as headaches and muscle pain. Other serious respiratory symptoms can emerge as a result of the development of the disease, taking the form of the Severe Acute Respiratory Syndrome, or SARS. Based on the scientific evidence available to date, food is not considered as a vector of transmission of COVID-19. Also, the potential presence of the virus on food packaging is not considered sufficient to cause infections. The virus is passed directly through contact with an infected person's secretions. For example, droplets from coughing or sneezing, or indirectly through contact with surfaces that an infected person has coughed or sneezed on, and subsequently touching one's mouth, nose, or ears. During this COVID-19 pandemic, it is important that measures are taken to prevent the transmission of the virus in all work environments, and that includes the food production sector. Measures are taken to protect workers and prevent their infection by the virus, to preserve the food production capacity and prevent transmission of the virus to the community, maintain and enhance the safety of food products handled in the food premises, and preventing the introduction of new hazards that may be associated with the additional measures related to COVID-19 management. 3 key prevention pillars are pursued in food production operations. 1. To prevent the introduction of the virus into the food operation and ensure that workers are not infected. 2. Enhance food safety management measures and adapt them to the requirements of the prevention of COVID-19 transmission, and in particular to the requirements of physical distancing. 3. Review the work organization and management of human resources responsible for food production. The first pillar is related to the protection of workers and preventing the virus from entering these premises of food production. This can be achieved through preventing staff with any symptoms of COVID-19 or whose immediate family is affected by COVID-19 from accessing the food production operations, enhancing staff awareness and ensuring that staff and contractors report any symptoms and signs of illness and be attentive to them in an environment that promotes trust and avoids panic and anxiety, taking additional precautionary measures such as taking staff temperature upon accessing the food production premises. If a staff member was found to have contracted COVID-19 or is suspected to have contracted the virus, it is indispensable to inform the health authorities according to national protocols. The surface that the sick employee may have been in contact with should be immediately cleaned with the appropriate agent. The employee should be immediately sent home and told to follow national protocols for infected individuals. Any close contact within the food production operation should also be sent home. It is possible for employees suspected to have contracted the virus to return to work after 14 days, which is the incubation period of the virus if no symptoms have appeared. Those who were sick can return to work once declared cured by national health authorities. It is important to introduce and apply the precautionary measure of physical distancing as much as possible through a number of interventions. Apply spacing measures between workers such that the safe distance of at least 1 meter between employees is achieved, and adapt production lines accordingly. Redistribute employees in workspaces. Avoid situations where workers may face each other along food production lines. Take any measure that can prevent possible transmission of the virus, even from asymptomatic individuals, in the work environments, such as limiting the number of workers in a given food production area, assigning workers in different groups and limiting contact between different groups. The second pillar focuses on enhancing food safety management measures and adapt them to COVID-19 prevention requirements. It is important to reinforce good personal hygiene requirements for food operators, and in particular multiple and routine hand washing, before starting work, after cleaning duties, after handling waste, before and after handling delivered products and touching multiple packaging services of non-controlled origin, before and after wearing protective gear such as masks, after removing or changing gloves or when gloves are torn. Hand washing should use water and soap and should be thorough and last 20 seconds at minimum, rubbing all hand surfaces. It is possible to use approved hand sanitizers where the concentration of alcohol should be at least 70%. Food operators should maintain their regular protective gear, blouses, hair cover, boots where applicable. with added attention to their level of cleanliness. If wearing a mask is made compulsory, either for occupational health reasons or otherwise, it is important to change masks regularly and to maintain them clean as recommended. Should gloves be used, they should be changed frequently and hands must be washed between changes, in addition to when gloves are removed. Gloves must be changed after carrying out non-food related activities, such as opening doors, handling money, or touching unsanitized non-food surfaces. It is also advised to multiply the frequency of sanitation practices, particularly for surfaces. All touchpoints, such as trolleys, door handles, phones, remote controls, should be sanitized more frequently. In all activities, and when changing sanitation protocols and procedures to account for the management and prevention of the COVID-19 virus, it is important to ensure that no other food hazards are introduced, such as the introduction of toxic chemicals or unapproved substances to be used as part of enhanced sanitation measures. Food safety management measures, such as cooking temperatures, pest management, or HACCP preventive controls, should be maintained and adapted where required. With the added attention of possible instances of food fraud through enhanced supply verification measures applied to domestic products and imports. The third pillar is related to the need to adapt work organisation and in particular human resources management within food production operations. It is important to solicit feedback from staff and operators on the impact of the new measures taken and their effectiveness, and to stimulate involvement and innovation. It is also important to ensure psychological well-being of staff through added awareness and measures to limit anxiety or panic amongst staff. Work organisation should be reviewed with the overall intent to protect staff and their ability to produce. Staff can be grouped in different teams that should be maintained separate at all times. It is possible to limit the number of individuals in a given food preparation area and to space out workstations where possible. It will also be important to limit the number of customers or delivery drivers who may come into the food operation at a given time. All resources should be mobilized to ensure food safety, to protect workers and to maintain the food production capacity at all times, and in particular during this pandemic.